Hello, you're welcome back to my channel. Today, I'm going to talk you through on successful tip to apply for the United Kingdom public health specialty training. You may already have known that specialty training in public health is a very competitive one, and a lot of people desire to enter into the scheme but don't get to enter into it because of how highly competitive it is. So because of that, I've decided to work with my colleagues who are also in training to just pick their brains about how each and every one of them approached their application period and what they think had made them successful. So that's what we're going to talk about today. But before we moving into what we are going to really talk about, I would like you to subscribe to my channel if you haven't done so and hit the notification button so that when we have new videos, you would have the opportunity to see them. So in order to give you everything and not forgetting anything at all, I'm going to be looking through the screen to go through the points one after the other. So it doesn't mean that I am not looking at you. I am, but I'll just have to look at the screen from time to time so that I'll give you everything. Also remember that every link that I'm going to be talking about in this will be written down on the description uh, section. So just when you go to the video, look at the description section, you'll be able to see all the links that would be shared so that you can take advantage of them. All right. We're going to talk about, start with the timeline and the stages of public health training in the United Kingdom. So usually it is just one application per year, which means that if you miss the application cycle, you have to wait for the next year. And usually the application cycle runs from around November-ish to March when you apply till when the offer is made. So, and there are different stages of the application. The first stage is actually the stage of you just applying. And when you apply through the website called Orel, the recruiters will go through all the things you supply to them to check for your eligibility. So that happens around November through to December, to early December, so early January, sorry. And afterwards, those who were deemed successful at that stage will be longlisted for the assessment center. So what is assessment center? It's a computer-based text that tries to assess three things, and those three components of the assessment center are also linking back to the eligibility criteria. So that will include situational judgment test to ascertain what you would do in a particular situation as a public health registrar. The other one is what is called RANRA. It's more like the numerical test, trying to see how numerical and quantitative you are. The last one, it's called the waxing laser test, which tries to understand if you're able to critically think and your cognitive abilities. So you are expected to do successfully well in this assessment center to move on to the next stage, which is the interview stage. The interview stage for the last few years, post-pandemic, it's always been virtual. So it means that the interview, you would have to do it with your laptop or computer. So far as you have internet, you can do that. So usually the interview, it's you'll be asked 6 questions, usually 6 questions, and also those questions link back to the person specification for the public health specialty training. So what does it tell us? You need to sort of read the person specification of public health training to understand what is expected. Because from the application, when you apply through Orel, through to the assessment center, which tries to ask you questions around situational judgment, quantitative reasoning, and verbal reasoning, and your critical thinking ability, down to the interview, it always has a way to link you back to that person's specification. We would not talk about the eligibility criteria, whether you would be able to apply or not. I'm going to pop that on the description, the link where you can get all those frequently asked questions to be able to know whether you're eligible in the first place to apply. But just know that public health specialty training is available to both GMC registered doctors and other public health practitioners who justify their eligibility. Okay, now I'm going to go to tips for successful application, because that's really what the video is all about. It's not all about other things, but how you can prepare if you are already in this, if you're already in the journey to applying. All right. Like I mentioned earlier, I worked with my colleagues who are currently registrars as well, who recently passed the exams, to pick their brains on what they think was helpful for them in preparation. And I'll have to add a disclaimer here that these are their personal ideas, not necessarily any official representation. So don't put this as any official information. But these are some of the things that you could do to help you boost your chances of getting into the training. So I asked them 4 questions, sort of a survey, 4 questions to see how they prepared. And these are the responses from my colleagues. So I'm going to read them through the screen, and we'll talk about each of them after their responses. Thank you. So the first thing we talked about, I asked, was what resources did you use to prepare for the assessment center? And overwhelmingly, majority of them said they use job test prep. So job test prep, it's one of the software, online tutorials that you could subscribe to, and it takes you through the various components like the institutional judgment test, the RANRA, and the Wasing laser test. So many people, or all of them actually, subscribe to that. And but the difference is that people had different number of months they subscribed. One of them said I did 1 month. The other one said I had to do up to 3 months. So it depends on your level of preparation, I would say. And one of them said I met someone who used AI to generate situational judgment test questions similar to the sample questions on NHS England website, and the candidate ranked 99.8 percentile. So it's possible in this age and time that people use AI to also support in their preparation. You could leverage on that. Other materials apart from job prep tests that my colleagues used included GP and Foundation Doctor Focus books for situational judgment tests. So one mentioned BBC Bite Size, to help brush up your maths. Sometimes the RANRA part could be the problem if you are not very mathematical. So if you're looking for material to use for that, you could just go to BBC Bite Size. I will also put that link on the description so that it will be easier for you to source that. So this way, the materials that colleagues have used for the assessment center. Then the next question I asked was, what resources did you use to prepare for the selection center? So remember, I said the selection center is about the interview stage where you are going to virtually be interviewed by the panels. So you still need to prepare for that. And one thing that came up here is that the period, the distance between in time between the assessment center and the interview is not usually a long time. So you need to bear that in mind when you're preparing, so that you could know what to do at each point in time. So let me read out the things that my colleagues have responded to. One of them talked about Dr. Cath's website. So I'll pop that on the description as well. And person specifications, chat with current registrars and consultants, volunteer with local authority where I was based, and listening to public health news. So people had extra things they did, chatting to registrars and consultants. You could also volunteer to work in local authority if you've got that opportunity. Why? It's because it will give you opportunity to know what goes around in public health in England and other parts of the United Kingdom. The other colleague said that I listened to a lot of podcasts, including the NICE podcast and the Public Health Disrupted, training in public health, and read up and made notes on public health topics. Then I also practiced responding to case studies using frameworks, wrote and practiced answers to questions I thought likely to be asked. So you would see that this other colleague had a variety of things that they did to see them through, including listening to podcasts and practicing to answer questions using framework. So you can get in touch if you want some of those support. Uh, I can signpost you if I'm not available to help at that point in time. I can support you to some persons who could be of help to you. So the other person said, I looked at the curriculum. So there's the public health curriculum, public health training curriculum, foundational public health online course, Oxford Handbook of Public Health. So these are some of the textbooks that people consulted to prepare. Then some other colleagues said I attended regional public health induction events and public health disrupted podcast, looked at the Faculty of Public Health website. So these are a range of materials you can access and use them to prepare. There are so many of them, and I have listed them for you so that you would know that these are things you could do to help you. So I'll go to the next question I asked and feed you in with the response from my colleagues. So what's the length of time you put into preparation for the application? So I wanted to find out a bit of range of time people used when they prepared. You know, I can't tell you it's 6 months or it's 1 week or 2 weeks. So I decided to ask around how long it took colleagues to prepare in months. So one of them said assessment center I used 3 weeks, selection center I used 1 week. This one must be a very super intelligent one just to do that. And the other one said 1 month assessment center, so that's 4 weeks, and 2 week selection center. The third one actually said 6 months, which to me is also good, depending on how fast or how slow you are. You can do it as long as you want. The end goal is for you to get into training. So started exam prep as soon as I submitted application, started interview prep straight after the exam before I knew if I had an interview. So 6 months. That means that if you want to apply for the next round, which is around November of this year, so you would have started by now to prepare for the application, for your assessment center, and for your selection center. The other two colleagues mentioned that they prepared for 3 months, and this other colleague said, I really wanted to enter into training, so it took them 3 months to prepare. So it's up to you to know how long you can prepare. If you're a slow reader, if you're slow in preparation, then give yourself more time to prepare. But if you think it's just a quick thing for you, then that's still okay. If you can prepare in 2 weeks or in 3 weeks, then why not? The last question I asked, and wanting to know if there is any other specific thing people had to say, I asked them Any specific top tips for potential candidates wishing to apply for the next round of application? The next round of application is around the corner, so just for you to know. So one of them said, just practice, practice, practice. I can't say this enough. Practice, practice, practice. So with job test prep, ensure you are consistently scoring above 90% of test takers. In the actual assessment, you are likely to need to averagely do better than 80 to 85% of other test takers. See, this is super competitive, and it means that if you subscribe to job prep test, I'm not doing advice for them, but it's a good material for you to use. So you need to practice so regularly and often that you are scoring so high in all the three components. And the other person said, starting early really helped me. You see it again, starting early, especially for the interview. You get very little notice that you have made it to the interview. So I recommend starting preparing as soon as possible, and definitely before you are notified, if that's possible. So one mistake some people might make would be when they have gone through the assessment center, they are waiting to be notified about whether they passed or not. You don't have to wait for that. As soon as you're done with each step, move on to the next step, because you don't really have enough time to prepare for that. The other colleague said, good luck. Get to know the curriculum and basics of public health, how systems work in UK, and some principles. Yeah, it's good to understand the basis of public health and how systems work in UK. Yeah, but this should not also be a deterrent for those of us who are not primarily from the United Kingdom. So it's possible that you're watching this video from abroad, anywhere outside the United Kingdom, and your public health system is different from that of the United Kingdom. That should not deter you. Most of the questions, or the questions that you're going to be asked, will be pointing towards the person specification, which is something basic about public health. So this should not be a deterrent for you for you from applying. Yeah, the last response, which I think is really very important, it's think like a public health registrar. So you need to begin to think like a registrar to respond like one. Of course, you're not yet into the training, but you need to begin to think, have that mentality, because all the things you're going to be doing for the next 5 years or more, depending on how long your training lasts, if you enter into the training scheme, will be to train as a public health registrar. So you might as well begin to think like one and begin to see how your thinking will fit into the person specifications. So I've just gone through in a quick, in a quick manner, all the things you need to do for you to successfully apply and get into training. So if you have any question, you can ask, drop it at the comment section, and I will be able to respond to that. Thank you for listening to my videos, and I'm looking forward to seeing you in the next video. Bye.